Today, we're going to be talking about the pelvic floor. It is a part of the body that is often neglected, I believe, and it's something that you do not always report to a primary care provider unless something is actually happening with it, which is critical, right? It is a part of the body that I want people to start paying attention to, both men and women. I'm about to demystify the fact that only women suffer from weak pelvic floors. A man also has a weak pelvic or has the potential of having his pelvic floor weakened. It could happen through like an injury, surgery. There's certain medical conditions like diabetes that will cause pelvic floors to weaken, and also trauma, right? I talked about trauma, talked about surgery, and talked about just diabetes, right? It is something that would not be alarming until you have issues with controlling your bowel or your bladder with incontinence, right? There's the urge incontinence, there's stress incontinence, and then there's the incontinence that you're not aware of, which is a medical emergency. It's called saddle anesthesia. So you pee and you poop on yourself without really knowing that you did that to yourself. That is a 911 call. Go to the ED. Before you get to the point of being incontinent when you pee, or your incontinence of poop, feces, or just pain with general ambulation, it occurs over time. Being overweight doesn't help. Being a smoker also kind of worsen things or make it more likely for your pelvic floor to be weakened. Being obese is also a risk factor. Those are all things that we can modify, right? Those are modifiable risk factors. Surgeries, traumas, those are things that often we can't really like prevent those. It is very important that you pay attention again to your body. The pelvic floor houses very important organs, reproductive organs, houses like the bladder. It controls, directs blood down to the reproductive organs, so it controls ejaculation and orgasm in both men and women. It is very important. Protect it, right? If your pelvic floor is weak due to age is a factor. It's not always like not every old person or older person has a weak pelvic floor. It happens in young adults and even teenagers. Like I said, it's a medical condition in certain people, right? It is important that you do all the things that you can do to strengthen it. Exercise is one of them. Losing weight, limit to no alcohol, stop smoking, and also just again exercising. There's an equipment in my showcase. Sorry, I thought I lost the signal there. There's an equipment in my showcase, the stair stepper that I got to help me get my Kegel exercises in. It is very useful. It's very important. I uploaded a video on the maneuvers, how I do the exercises on that equipment to kind of help strengthen my pelvic floor and also get my Kegel exercises in. You can check it out. It is also very important that you eat the right things. Limit salt, spicy foods, low like reduce your fat, the amount of cholesterol that we consume, saturated fats, unsaturated fats, we need to limit those. It is important that you stay regular with your primary care provider. If you do have a diagnosis of a weak pelvic floor, follow your medical doctor's recommendations, do your homeopathic medicine, whatever works for you to strengthen that pelvic floor. It is very important that you do those Kegel exercises. For women especially, works great. And there are ways that you can start seeing that your pelvic floor has an issue before it becomes really too late. So pay attention to your body. The pelvic floor, again, should not be neglected. It does a lot of great things for us, right? Postural stability, provides support to the spine, also helps the respiratory muscles like the diaphragm, kind of helps it like contract and relax with respiration. So it's very important. It also supports functions like I talked about, like it houses the reproductive organs in both men and women, prevents prolapse for women, especially after childbirth. Those that haven't had children also suffer from uterine prolapse. So it is important that the pelvic floor stays healthy. I talked about incontinence, both bladder and bowel incontinence. It is very important that we kind of stay on top of our pelvic floor health. Again, sexual function. I talked about supplying blood down there to those reproductive organs, those high sensitive sex organs, like for both men and women, right? It helps you with ejaculation, helps with orgasm, right? It's very important. Abdominal pressure, right? It kind of helps also regulate or maintains the bowel, all those loops of bowel. It helps hold them in place. So if it's weak, then it can start prolapsing and puts other people at risk for hernias and things like that. It is important that if you have any questions, medical concerns, reach out to your primary care provider. It is easier to prevent a problem than to treat the problem. Besides the cost, it takes a toll on your health. Stay active. Preventative medicine. I'm a believer. I'm a huge advocate for preventative medicines. Take care of yourself before you need the doctors to take care of you. Like always, thank you for watching. Do not forget to like, leave a comment, repost, share to help someone else. All right, thank you.